Hi, Maria Rebozo Lapine, your host of Cafecito Time con Equality Health. In this segment, I have invited Perla Acevedo Torres. She's with the ALMA organization. ALMA is the American Latin Medical Association. I invited Perla because many of us struggle knowing when to go to the emergency room and when to use our neighborhood urgent care clinics. And what about the mini clinics? I know our primary care providers should be our first choice because they know us better, they know our history, they know what medications we're taking. But what do I do if our doctor's office is closed? There are options other than the emergency room, and that's what we're going to be discussing today. Perla, welcome to our cafecito.
Hi, Maria. I'm happy to be here.
And I do want to let them know that you are a physician. You have your certification. You got it in Guadalajara, Mexico.
Yes, indeed.
And Guadalajara is one of my favorite places to visit. It is amazing and it's beautiful and it has a lot of history. So welcome.
Thank you.
As you heard, I mentioned that our first choice should be to see our primary care provider, because they know us better, because they know what medications we're on. But what are other reasons that we should focus on seeing our primary care first before we seek other options?
Yes, Maria. The importance of seeing the primary care physician, it's because they know us better as a patient. If we have been established with our provider for some time, they know what medications they have us on, and they clearly monitor also how well they're working for us. You know, as long as we're maintaining that open communication and letting them know our symptoms with them, any side effects that we're experiencing. So a primary care is our team as far as patient and doctor relation in order to maintain that optimum health.
You know, you mentioned something very important, open communication. To have open communication, that means you have to have a provider that you trust. So if you don't have one, contact us at Equality Health and we'd be more than happy to find someone. So let's get straight to our topic. Like I said, many of us struggle with knowing when to go to the emergency or urgent care or those many clinics. But I wanted to start with the urgent care because I see them all over my neighborhood. When would be the appropriate time to go to the urgent care, and what are some examples?
So, Maria, with urgent care, I would escalate things that can't wait for a primary care visit. If, for example, even if it's a weekday and your provider may be saturated with appointments and it's absolutely unable to see you, I would escalate something like a fever that you're possibly experiencing symptoms of a UTI with moderate pain and a mild to moderate fever. That's something that could be addressed at an urgent care. You know, they can collect a sample of the urine, send it to be cultured, and in the meantime, give you a temporary dose of antibiotic regimen.
And UTI is urinary tract infection.
That's correct,
Which
Maria.
happens to men and women.
Yes.
I have children, so earaches is another thing that happens usually when the doctor's office is closed. Is that an urgent care or is that an emergency room?
An earache, it's something that can go to an urgent care because, you know, the providers there are highly specialized to do that focus assessment and to also perhaps provide antibiotics if those are needed based on the physical exam.
And the last one that happens often is a sore throat. Do I go to the urgent care or do I go to the emergency room?
So with sore throat, depending how severe the symptoms are, you know, we've all experienced a little sore throat, and so, you know, as long as it's something that you could perhaps manage overnight at home with maybe just like a cough syrup, an over-the-counter syrup, perhaps the following morning you can set up an appointment with your primary care provider and have him be the first person that will see you and evaluate you during the day, and that can easily be directed to your primary care provider. If it's a sore throat that has shortness of breath accompanied with it, and that you're experiencing just very difficulty breathing, then I would escalate that to emergency department. But if it's a minor sore throat, we can easily try to manage it overnight at home with a cough syrup, and then the following day schedule appointment with primary care provider.
Perfect. So let's move on to the emergency room. This is the emergency room in the hospital, because I know that a lot of us use it as the doctor's office. So I want to talk about what are some examples of when we should use the emergency room.
So Maria, with the emergency room, I like to save that for much more severe physical symptoms or illnesses. And what I mean by more severe, we're talking about a chest pain that it's just not subsiding on its own with rest. That's something that will require further treatment because we are perhaps experiencing myocardial infarction or something that could escalate as far as the stroke. So shortness of breath also comes along those lines of something that shortness of breath that's just not relieved with rest or any other treatment at home treatment. Definitely escalated to an emergency department. A blunt trauma where we're seeing excessive bleeding or bones that are exposed, those are things that definitely need to go to emergency department because they will require additional specialty visits and perhaps even surgical procedures.
Perfect. And we have a few minutes. I want to also talk a little bit about those mini clinics. Those are the mini clinics that you see at the pharmacy, the pharmacies in different corners of where we live. What would we use those mini clinics for?
So for mini clinics, we can use them for annual vaccination screenings, and they can also be used for, again, something like a fever that's not relieved, a fever from either a sore throat or fever from perhaps symptoms of a urinary tract infection. That's something where you can be easily directed to start antibiotic treatment and even send specimens for cultures.
And also, I want to make sure that we mention that if we end up in the emergency room or in urgent care or even one of those mini clinics, it is important to do a follow-up appointment with our provider, correct?
Yes, most definitely. All of those will require follow-up appointments because, again, our primary care physician will be the one that will ensure that we are fully back into our maximum health post experiencing that episode of an illness.
Anything else that you think that is important that I should have, that I missed, that I didn't ask, that you think should be included?
Well, I just think that overall, if there's anything that you're questioning where to go or where to seek care, I think it's just if it's during the day, definitely always start with your primary care physician, number one.
Thank you so much, Perla. I really appreciate you being here. I think this is a topic that a lot of us struggle with many times. So I want to thank you so much for being here in our segment today.
It's my pleasure, Maria.
And I want to thank you for joining us today. I hope that you found this information valuable. As Perla said, it is important to make sure that our first choice is our primary care provider. But if it isn't, now you know. Now we have the information for the emergency care, the urgent care clinics, and the mini clinics. Share this segment with your friends and family because they might be struggling with this information as well. Cheers to your good health.